President Trump has now unveiled his latest plan to dramatically decrease the cost of drugs for in vitro fertilization, or IVF, here in the U.S. So according to healthcare company GoodRx, the average price of a single IVF cycle is between $15,000 and $30,000. That's on top of additional medications, which can cost up to $7,000 or more. During his Oval Office announcement on Thursday, the president said he had negotiated an estimated 73% decrease in the cost of drugs for each IVF cycle.
Americans will be able to opt in to specialized coverage just as they get vision and dental insurance. The result will be healthier pregnancies, healthier babies, and many more beautiful American children.
President Trump says biopharmaceutical company EMD Serono has agreed to provide massive discounts to fertility drugs they sell in the U.S. In a statement, the company said all of its IVF therapies will be available on the Trump RX platform, launching in January. It's not clear yet, though, how much the lower drug costs will decrease the overall cost of an IVF cycle. For more on this, let's bring in Julie Rovner. She is the chief Washington correspondent for KFF Health News. Great to see you. Thank you so much for being with us. Julie, the president is saying that this new deal will slash the cost of drugs that are used in IVF by an estimated 73%. That sounds like a lot, right? So is that going to be passed on to the consumer? How much are people really going to save?
Well, as your graphic pointed out, drugs are only a small portion of what IVF actually costs. So if you have health insurance that covers IVF, you're probably already getting a discount on the drugs. And if you don't have health insurance coverage that covers IVF, it's probably still going to be too expensive for you to foot the bill yourself, even with these large discounts on the cost of the drugs. So it's a nice thing, but it's probably not going to put a big dent in the number of people who can't afford IVF now, who would like to afford IVF in the future.
Okay,
and it's hardly what the president promised.
Yeah, speaking of insurance, Julie, wanted to ask you about that because the president is saying that his administration is now working to make it easier for insurance companies to actually offer supplemental fertility coverage. How would this really work?
Well, it would help a little bit, but the fact is the president promised on the campaign trail that he would either have the government pay for IVF or he would mandate that insurance companies pay for it, and he is doing neither. So even if companies could offer sort of standalone infertility coverage the way they offer dental coverage, for example, again, it's hard to know how much of a dent that's going to make. Right now, employers who can afford to provide this coverage do, but most employers can't afford it, and they don't. Not Medicare nor Medicaid provides this coverage by and large, and most people with employer coverage don't have it either. Only a quarter of the largest companies offer IVF insurance coverage.
I just wonder, especially because I grew up in Canada, and obviously the healthcare system is different there, but it is free or a fraction of the cost for people who elect to do this. How did we get here? Why is it so expensive here in the U.S.?
Well, everything is expensive here in the U.S., and this is considered an optional sort of type of procedure, even though there's obviously an ongoing debate about whether or not we should be having more babies in the United States, and this is something the president says that he wants. But it's not something that has been largely included in insurance coverage because it's so expensive. The Affordable Care Act requires many things to be covered. This is not one of them, again, because of what it would have done to the premiums for most people.
Okay, Julie Rovner, such a fascinating discussion. We'll have to leave it there for now. Thank you.
Sure.